one thing that I really want to talk about, because a lot of things in the landscape of veterinary medicine have evolved because of COVID. COVID brought a lot of people getting a lot of pets. And even though you have 101,000 veterinarians in the AVMA, there's millions of pets. And I think the ratio, there's a gap. I have great veterinarians. Casa Linda Animal Hospital, Dr. Deb, Charles, shout out. I'm telling you, people need to know about telehealth medicine in the field of veterinary medicine. And I understand that's something that you're very, very supportive of and involved in. Can you talk a little bit about that? How the scene is shifting with people?
Yeah, absolutely. I am very passionate about the appropriate use of telehealth in the veterinary space. So I think it's really important that everyone establish a relationship with a veterinarian, especially while your pet is healthy. So, of course, all pets should have an annual exam, get their appropriate vaccinations and what have you. But telehealth can be really helpful in several ways. One, if you have an emergency, teletriage, so triaging what is going on with your pet is huge. Certainly, if you think your animal got into something toxic, you want to know if there's something you need to do at home before you seek further veterinary care. Right now, it is so hot. We're seeing so many cases of heat stroke. So I want to be called or have a teletriage visit so I can give the pet owner some advice on what to do before they rush their pet in for further assessment and care. So teletriage, amazing. And the other piece of that, yeah. And the other piece of that is go ahead.
Well, we teach people that in our pet first aid classes that we're that life-saving bridge between the O and the veterinary clinic. And we very much work with veterinarians. And so when I'm teaching people about heat stroke, what color is a bad color on the gums, Dr. Lori?
Anything that's not pink.
Yeah. And second, I say, you should something cool to their paws because they sweat that way. And now here I'm going to make a fool of myself again to make sure people never forget the dangers of giving a hot dog ice. I say ice, not nice, baby.
Yes. Excellent. Yes. Well, I will tell them to get a cool, not cold towel, wet it down and wrap them in that. And then they need to seek immediate veterinary attention if they think their dog is having heat stroke. And I'd rather them err on the side of caution and not delay that. So that's a real problem. And the other thing regarding teletriage, of course, we've all had that moment when we pop up from a sound sleep because one of our pets is throwing up. And we know that sound, that awful retching sound that wakes us up. So if you
don't want to make it on a radio, I'm gonna embarrass you. We got it. We won't.
I'm gonna pass on that. But we all know what it is. So if you are concerned when your pet is vomiting at 2:00 in the morning, you can have a teletriage visit and determine if this is something that you really do need to get dressed and go to see your local ER, or if this is something that can wait till the next day and you can contact your regular veterinarian. So sometimes it's just a way of removing some of that anxiety.
And go ahead.
Yeah, go ahead. No, go ahead.
Well, I was going to say another Benny of telehealth is sometimes the lobbies are very crowded. There's hard to get a booking for a non-emergency, maybe a follow checkup on a suture look or something like that. Can you give us some of the benefits of how to use the time of a veterinarian most efficiently?
Yeah, that is one of the biggest ways that we can use telemedicine is for follow-up visits. So definitely post-op incision checks. Maybe you had your cat spayed 3 days ago and the incision looks a little bit red and you're concerned about it. Okay. And the last thing you want to do is put your cat in the carrier and go back. But you can have a telemedicine follow-up with your veterinarian, take some pictures of the incision or show it on the video, and your veterinarian can say that's normal healing, or, that doesn't look right. Maybe your cat's been licking at it. These are some things we need to do. But we can also use follow-up for skin infections. If your veterinarian wants to have a recheck 2 weeks after you've been in with your dog for a skin infection and you want to determine how your pet is responding, things like that. So there's so many ways that we can use it. behavior
I
clubs.
love it. I mean,
Yeah.
just think, bring you back to 1990 at Texas A&M
Hmm.
to now president of the American Veterinary Medical Association 2023. You've come a long way, baby.
Definitely a long way. And
Think of what has happened in veterinary medicine just in your
huge,
time.
huge. So many advances. And I love it because that means I'm always learning something new. And I love that. I'm a curious person, so I always love something new.
Well, so when you're not being a veterinarian and you're not running the AVMA, surprise our listeners. What's something you like to do for fun? And make sure it's legal.
Yes.
What do you like to do? What would
Oh,
surprise people? What or hidden talent?
Hidden talent. I don't know about that. We love to travel. My husband and I love to explore new places, both domestically and internationally. So we do a lot of that. I am a gym rat, so I'm in the gym almost every day.
I'm not going to arm wrestle you. Okay, that's good. Okay.
There you go.
Yeah.
We can have a push-up contest. Okay. So I do a lot of that. Love to read. And we have a son and all of our family is nearby. So we spend time with
Nice.
family and some good friends as well.
Well, any parting message you want to tell our listeners? We've got zillions tuning in all over the world because you're on the longest running pet podcast on the planet.
I love that. And I love that there are so many people that love their pets. So do right by your pets, get regular veterinary exams, make sure they're vaccinated appropriately. Oh, and that goes back to the travel. So Lyme disease isn't a big problem for us in Texas, right? But if you are traveling to New England, you may want to talk to your veterinarian before you go about the Lyme vaccine. But wherever you're going, especially if it's not nearby, find out if there's different preventions or vaccines that your pet should be on as well. Otherwise, stay healthy, give your pet lots of cuddles, lots of exercise, and definitely keep working on the training and having a well-mannered pet.
I love it. Hey, everybody. We have so enjoyed having Dr. Lori Teller of the American Veterinary Medical Association on our show. We got some great tips on how to travel, stay at hotels, dine with them, and kind of a little more insight into the world of veterinary telehealth medicine.